Hi, it's Dr. Isabel Casimiro, endocrinologist. So today I want to just go over diabetes. Let's get down to the basics. Diabetes is a condition where your body cannot manage blood sugars. In order to manage sugars, we need insulin. Insulin is basically the key that allows sugars to go into the cell. When the body does not have enough insulin or the insulin is not working well, that's when you get high blood sugars and you get a condition called diabetes. So the two main types of diabetes are type 1 diabetes, which is an autoimmune process in which your body starts to attack the insulin producing cells of the pancreas. So you don't have insulin in this condition. So the way that we treat it is basically by giving you insulin. The other type of diabetes is type 2 diabetes. Type 2 diabetes is where your blood sugars have been elevated for some time, that your body needs to make more and more insulin. Eventually, the same amount of insulin doesn't work to keep that blood sugar at a normal range, so you have to make more and more insulin, sugars stay high. This is a condition called insulin resistance, where your body doesn't respond to sugar in the same way. Insulin resistance is basically the first step that happens before you develop pre-diabetes and then go on to develop type 2 diabetes. Type 2 diabetes is very common. About 90% of all diabetes cases are type 2 diabetes. And they are very common in certain ethnic groups. Latinos are predisposed, African Americans, Asians, Pacific Islanders, Native Americans. We have the highest rates of diabetes. So if you belong to one of these groups, you're already at high risk of developing diabetes. The risk goes up if you have family members that have it, if you have excess weight. So we're going to talk about ways to reduce your risk of getting diabetes by things that are modifiable, meaning things you can do something about. We can't change where we're from or our genetics, but we can change our environment, because environment does play a major role in what gets activated in your genetics. That's called epigenetic regulation. Diet and lifestyle have been shown to play a huge role in the development of diabetes and in the control of diabetes if you already have it. So just because everybody nowadays seems to have type 2 diabetes or pre-diabetes doesn't make it normal, and it doesn't mean that it's okay to just let it happen to you. And there are things you can do to try to minimize that risk. We're gonna go over that through my posts and on my webpage. So take care of your body, take care of your mind and spirit, take care of yourself, and I'll be seeing you.